Hi, I'm PJ, and I'm so excited you're going to watch this webinar and learn all about light therapy. I'm going to teach you that light therapy is great for pain relief, but there's also all kinds of other applications that we can use light therapy for, including beauty, de-stressing, and there's all kinds of health benefits with light therapy. So let's get started. Just a little bit about me. I found light therapy because I personally was struggling with all kinds of chronic pain. I won't get into the nitty-gritty detail, but it started with my feet and went up my body. So I was just really fortunate, probably about 8 or 9 years ago, to meet a chiropractor who was using red light therapy in his chiropractic practice, and he started using it on me, and it really made a tremendous difference. And I ended up finding InLight and purchasing my own system. I started using it every day, and I'm going to tell you, my life is so different than it was 8 years ago. I feel great. I'm so grateful to feel great. I'm able to be active, golfing, hiking, and all the great things that I get to do where I live. And in that journey, I decided to get certified in light therapy so I could share it with other people, which I have done. Since then, thousands of clients who've learned about light therapy, and I'm just so excited that you're someone that's actually listening to me and letting me present all the facts about light therapy. I come from Chicago, but I now live in Arizona. And one of the things that I have really enjoyed doing over the years is actually speaking. I do a lot of webinars, but also live events, and it really excites me to teach people about light therapy. A little bit about what to expect today. We do not diagnose, treat, prevent, or cure any disease. I'm going to just talk about light therapy and how it helps the body do what it's supposed to do and can do. We'll go over some of the science behind light therapy. And we're really going to specifically learn the benefits of red, blue, and near infrared. These are the color wavelengths that are used in the InLight system, and how we use these colors to help slow down the aging process of our cells and our bodies. We're definitely going to hit brain health. I'm going to go over many uses for light therapy. I always love to interject some anti-aging and rejuvenation information, and definitely some research and testimonies, because that's definitely a wonderful thing to hear. And we will be going over options for using light therapy. The InLight Therapy light therapy device is FDA cleared to increase circulation, reduce pain, reduce muscle stiffness, muscle tightness, and muscle soreness. Those are the 5 bullet points for the FDA clearance for this medical device. And now we'll talk about what that actually means. This is probably the most important thing that I'm saying today, and I hope that you take from this. The number one thing that our bodies need to heal, whether it's just pain or an injury that needs healing, the number one thing we need is circulation, because where there's pain and inflammation, we need better blood flow. Our body needs better blood flow in order to kick in healing. Healthy blood flow is everything. Light therapy is not a band-aid. It's a solution for helping regenerate, repair, and rebuild tissues, and just help the body recover from whatever it's dealing with. A lot of people think light therapy is new because it's really hot and people are seeing it everywhere. But actually, there's quite a lot of history with light therapy. In the 1800s, there was a Nobel Prize given on a scientist study on red light and tuberculosis. In 1980, NASA kind of put light therapy on the map. Really cool. They were trying to figure out how we can grow plants in space, and they started playing around with all these different wavelengths and found that red light was really, really beneficial to the plants, that part of the light spectrum. And not only did the plants thrive, but also the astronauts started really thriving and feeling better, and just overall health markers were better. So that was really a kind of a pivotal moment in NASA history with light therapy. In 2007, the first research came out on neurological things, all kinds of different conditions. Now there's been a lot more since 2007. We'll go over some of that in a little bit. In 2010, Light therapy is kind of becoming part of the modern medicine toolbox. And today, it's pretty much exploding. We're seeing light therapy everywhere. So it hasn't been just in the last couple of years that light therapy all of a sudden has just appeared. It's been a long line of history with this therapy. There are even some experts that believe that this light therapy industry will explode to a $1 billion industry by next year, 2025. So yeah, you're going to start seeing it everywhere if you haven't already. Social media, estheticians, all kinds of different clinicians. But most of all, where I've personally in the last 8 years seen this tremendous growth is light therapy in the home. People are figuring out that doing the light therapy on a daily basis, as in my case, can make a real difference in their lives. I choose to use InLight Therapy in my light therapy practice, and for many reasons. I know the owners personally, and they're incredible people. They're located out of New Mexico in the US. They've been making these systems for 40 years. They know what they're doing. They have great customer service. They have a great warranty. They use 3 colors, which you don't see a lot in the industry, and we're going to learn all about those 3 different colors they use. They have super intense medical grade diodes for the best efficacy. There's flexible pads that can wrap around your knee or your shoulder or your hip. I love that. There's all kinds of different frequencies that are pulsing the light. That's called multi-progressive pulse technology, which I need a whole nother hour to explain what that does, but it's just icing on the cake with the InLight device. And it's really easy to use in the home if that's what you choose to do. So I love InLight and I love using their system in my practice. A lot of people think light therapy is alternative medicine. It's like way off in the woo-woo stuff, as some people call it, but it's actually quite functional and integrative. It falls really in between traditional medicine with the surgeries and the meds and all that stuff, and also the natural medicine with the herbs and all the Reiki and energetic things. It's really right there in the middle, and this happens to be the number one growing field of medicine is in the middle, functional medicine, integrative medicine, and that's exactly where light therapy lies. I kind of hit on this in the beginning about healthy circulation and how important it is, but the bottom line is inadequate blood flow slows down the healing of any illness, injury, condition, or even can further complicate already existing medical conditions. Healthy circulation is everything. So, what is LED light therapy? You can see the pads that people are putting on their bodies. LED light therapy stands for light emitting diodes that produce visible and invisible light waves that are delivered through pulsed frequencies. We just talked about that multi-progressive pulse technology. It's actually, the light is actually being pulsed by different frequencies to stimulate all kinds of responses. The LEDs or the light pads are applied directly to the skin. And when you do that, we're going to stimulate a process called photobiomodulation, which is increasing circulation, and a whole lot of other things happen in the cells, which we will go through now. Just kind of a science slide. If you look at the top left of this, the lights are on the skin. That's the dermis level up there, that brownish orange strip. And the near infrared, red, and blue lights are applied to the skin. And what happens is the light shines into the cells and it stimulates the mitochondria. In fact, it supercharges the mitochondria. If anyone knows anything about mitochondria is the powerhouse of our cells, and it is absolutely responsible for all things health related. So the lights stimulate the mitochondria to do what they're supposed to do, which is release nitric oxide and also release ATP. So let's talk about nitric oxide for a minute. That is a gas that, oh my gosh, there's so many benefits to nitric oxide in the body. But one of the number one things that nitric oxide does is helps vasodilate everything, and that's why you get increased circulation. Once the once the mitochondria releases the nitric oxide and shoots out ATP, a whole host of other healing substances are released in the blood, anti-inflammatories, analgesics, all kinds of things. And at the end of the day, that's why you're going to get the health benefits and the pain relief. And this is a stimulus called photobiomodulation. Photo meaning using light, bio meaning to create change in the body. So photobiomodulation. So why do we use blue, red, and near infrared in light therapy? Mostly you'll see things about red light and near infrared light, but again, InLight offers blue. But why these colors? What you're looking at is part of the light spectrum. So you go outside in the sun, and there's this huge light spectrum that has all these different wavelengths in it. And on one side, there's UV, and on the other, all the way at the other end is radiation, and then there's all these wavelengths in between. So this is just a little snippet of part of that light spectrum. And what science has figured out in much research is that the human body reacts really, really, really well to blue, red, and near infrared with some very specific benefits that happen with each of these. This is over years and years and years of research that they figured out that blue, red, and near infrared, that part of the light spectrum, is really good for the human body, whereas some of these wavelengths are not. So it's really harnessing what's really good in the sun and delivering it in a very safe way. Now that we know what colors are being used in the InLight system, let's talk about what they do. This blue light on the left really only penetrates 2 to 3 millimeters. It's got some really cool benefits to the skin, and I'll definitely be talking about that, but it's only going to go skin deep. So we use blue light, for skin conditions. The red is going to penetrate 8 to 10 millimeters, so it's going to get into the soft tissues. And then the near infrared is what goes really deep down into the bone level. So those wavelengths all penetrate at different levels. Blue light is a really cool wavelength that offers some really specific benefits for the human body. Again, it only penetrates skin deep. One of the great, and I could go into a good 20-minute what each color does, but I'm just going to hit some of the ones that I really think are important. Blue light's great for fine lines and wrinkles. It's used in anti-aging. It's great for acne. It kills bacteria. It's very supportive to the liver. Think about when babies are born with too many bilirubins, their livers aren't working properly. What do? They put them under blue light. Again, antimicrobial properties. So there's great research that shows that light therapy or blue light therapy kills MRSA, where, antibiotics were resistant. So that's a really cool thing, especially with wounds that won't heal. So blue light has some very specific benefits. So when I talk to clients, we talk about all the conditions that they're looking for light therapy to help with. And if it is skin related, we're going to start talking about blue light. Red and near infrared are going to go deeper. So this is what we're going to use for pain. It reaches deeper down in the body, so it's going to help rebuild and regenerate tissues. It helps increase collagen and elasticity for anti-aging. That's a really great thing. Who couldn't use a little bit more collagen and elasticity? It really is just reaching cells at a deeper level, getting into the muscles, tendons, ligaments. It helps detox the cells. Light therapy is very detoxing, which is awesome. And it's just going to help with nerve regeneration as well. So there's a lot more things, but these are kind of the bullet points I like to go over. You'll see in this pad, if you look closely, it may be hard for you to see, but there's rows of red and then rows of lights that are not lit up. Those rows of lights that are not lit up are the near infrared, because that near infrared is just to the right of the visible light spectrum. So we actually can't see it with our human eye, but it is the deepest penetrating one that can get down into the bones, and it's also what can get through the skull. So what does a light session do? The InLight system has a pre-timed 20-minute sessions. When you turn it on, it lasts 20 minutes and it turns it off. And the reason is because the research has found that the most efficacious dose of red light is 20 minutes. And then after that 20 minutes, the healing and all the stuff that kicks in continues to happen. It's not just like removing a heating pad and being done. There's a lot of things that happen after the session is over. But the bottom line is you're going to put the pad on your body. The first thing that happens is your cells, the mitochondria, releases nitric oxide. We've already talked about that. And also makes ATP. I did not get into that in the last slide, and I will now. People who do light therapy on a daily basis or even a few times a week report that they have more energy, and it is a causal effect that their cells are making more ATP. If you remember what ATP is from your 7th grade science class, ATP stands for adenosine triphosphate, which is the energy of your cells. So people who are immunocompromised, sick, basically, don't make enough ATP, nothing's working right. And so those people really remarkably can tell a difference in their energy level. And it's no surprise to me because their bodies are making more ATP. At the end of the day, when the nitric oxide and the ATP and all the other healing substances are released, that's when you're going to get increased circulation. And that's when you're going to get all the different healing benefits that we've been talking about. There are so many uses for light therapy. Here are just a few. I'm certainly not going to read all of these, but I've definitely seen clients with all of these conditions and probably many more conditions than this. But the bottom line, I'm just looking at this list. Neuropathy is a really big one that I see a lot of people because neuropathy is a circulatory issue, so light therapy is really great for that. Digestion, plantar fasciitis, you name it. Look at the list, and if you don't see something on here that you're wondering about, by all means, you'll know how to get a hold of me that you can ask and we can discuss it. Same with skin conditions. There's so many skin conditions that can be treated with light therapy. Mostly blue light's going to help with this, but sometimes we pull in some red. So anything skin related is a wonderful option. At this time, I'd like to present some research. Crazy amount of research available on this therapy. I found this very interesting when I read this recently in a book. In the 1900s to 1950, there were 7 research studies. From 1950 to 2000, 370, 2001 to 2010, up to over 2,000. And then from 2010 to today, almost 12,000 studies. So light therapy research is exponentially growing. And it's because scientists are figuring out how light therapy enables the body to do so much healing. And so they were excited to study it for just about every kind of condition that you can imagine. It's very exciting. I'll quickly just go over a handful of research articles. This one was on light therapy. They did one session of red and infrared therapy, and it improved hyperglycemia, the parameters through the change of serum insulin, insulin resistance, and all kinds of things diabetes related. So one session. Light therapy is very, very assistive to the body who has diabetes, and also the complications that come along with diabetes. There's even research on red light therapy melting belly fat. People ask me this all the time because there's a lot of places out there that are spouting out all kinds of, fast, quick things of how to reduce belly fat. Here's the bottom line. In this study, there were 60 obese women, and they divided them up into 2 groups. And in one group, they did exercise with light therapy. And in the other group, they did exercise and no light therapy. And guess what? The first group doubled the amount of fat loss, and they reported greater increase in muscle mass. So this is a direct study on that. I'm not saying that it's going to eliminate all your body fat. The bottom line is we all need to keep moving. We all need to keep exercising. But if light therapy can help you feel good to exercise, then all the other beautiful benefits of maybe reducing belly fat could come along with it. Increasing bone density is a very, very important topic for the aging community. There has been research that has looked at light therapy helping increase bone density or reducing osteoporosis. So in this one, it's really simple. Group A had no light therapy. Group B did red light. Group C did near infrared. So they're taking the red light and the near infrared and doing it separately. The bottom line is red light showed a significant increase in mineralization over the no light group, and the near infrared showed the highest increase in mineralization. Remember, the InLight pad that I was showing you a few slides ago have red, a row of red and a row of near infrared, so you're getting both. How great it is to put light therapy, red and near infrared light therapy, up the entire spine every day to help with that bone density. That's a great use of light therapy. I know it sounds almost too good to be true, but guess what else red light therapy does? It helps increase testosterone, and there's so many reasons, not just from a nighttime benefit, but overall health. Testosterone is so necessary for muscle mass and bones and energy. And so in this study, the group that had red light versus no red light showed serum T levels increased dramatically. This is just something that happens with light therapy. So if increasing testosterone is a concern or something that you would be interested in, this is one way to help with that. There's even research that shows that light therapy helps with eyesight and different types of things that go on with your eyes. This is a picture of the InLight face mask. It's my favorite pad of the entire system, not only because it helps me with focus and clarity and things with the frontal lobe, but it really does help my eyes. And it's actually been researched and proven in this particular study. It showed that patients with macular degeneration, light therapy helped significantly improve visual acuity, and that there were no side effects. So in my opinion, this is just one of the no-brainers when you're doing light therapy, to use this mask just to help with not only your eyesight, bringing blood flow to the back of the eye, helping with the optic nerve, helping degeneration, that's happening as we get older, helping with the frontal lobe. There's just so many benefits to the face mask, which is why it's my favorite pad. I mentioned earlier that there's quite a bit of research on neuropathy. Neuropathy is a very painful condition that many, many people suffer from. It could be from diabetes, it could be chemo-induced, and it could be idiopathic, where we just don't know why they have neuropathy. But the bottom line, there's nerve damage in the hands and the feet, and when we can bring blood flow and actually regenerate those nerves, the nerves can regenerate, and that's what we see over time with neuropathy and light therapy. This particular study was out of University of Texas and published in the National Institute of Health, that showed light therapy significantly helped improvement in foot sensation and simultaneously a reduction in neuropathic pain. It's a wonderful, wonderful therapy. If you know anyone with neuropathy and they're on all kinds of meds and they're really telling them there's not much they can do, please tell them there is something they can do. Just a couple of before and after pictures. These are actually two different clients. Both have issues with circulation and blood kind of pooling in their feet instead of, circulating through the body. And this is just after one session. It just really helps move that blood flow and edema out of the feet. You'll see a picture of the boots, the InLight podiatric boots on that picture in the bottom. And it's designed to go underneath the foot and up the back of the calf and behind the knee, because that's the highway to the feet. But you can also fold those boots over into more of a shoe boot, which is kind of cool too. And I sometimes use both ways with my neuropathy clients. A lot of research on wound healing. This is actually my foot. I had a very deep and nasty cut and was able to heal it in 12 days. It's perfect. And this is just a study mentioning out of the National Institute of Health that they've reviewed a lot of studies on light therapy, and they've said it's an effective therapeutic modality to promote healing of skin wounds. So if you hurt yourself, like I did, I wasn't planning on it, light therapy is a great way to heal it quicker, faster, better, preventing infection and all those beautiful things. I apologize for the graphic nature of this picture. This is a diabetic foot ulcer. So diabetic complications can often result in foot ulcers. They're very, very, very hard to heal because there's not enough circulation in these people's feet. So this particular 80-year-old was actually able to save her foot. Many times this can result in amputations. So getting blood flow to that area, that antimicrobial blue light, red light, all of it can really help heal that wound and, thank God, prevent from an amputation. Out of the National Institute of Health, this is a review. They reviewed a lot of research articles and research studies and concluded, over the last 40 years, there's been all these studies, they concluded that light therapy has been shown to reduce inflammation and edema, induce analgesia, which basically makes it feel better, and promote healing in a range of musculoskeletal pathologies. So that's the National Institute of Health talking about inflammation and how red light therapy reduces inflammation. Anyone who's ever sprained an ankle knows that it hurts like the dickens and also takes a long time to heal. This is just a 1-week progression of a terrible sprain and what happened in a week after doing light therapy. She did it 3 times a day to heal the ankle. And what's interesting is there's actually a great research article that I don't have here, but it looked at sprained ankles and the group of athletes that had red light therapy over the group that didn't showed not only that the ankle healed faster, but the reoccurrence rate was significantly lower than the group that didn't do red light therapy. So while it's bringing the pain down and it's bringing the swelling down, it's also helping strengthen the tendons and all the muscles around it, which is a really important thing to do when you have an ankle sprain. This is a picture of one of my clients who had just severe knee swelling. And in one 20-minute session, he found his kneecap. That was pretty exciting. Research out of Harvard that was looking at rheumatoid arthritis and showed that light therapy helped reduce all the markers that were prevalent during rheumatoid arthritis. So very beneficial. Also, fibromyalgia is an autoimmune condition that is just awful if you know anyone that has fibro, but it's very painful, traveling pain. I have many, many clients that use light therapy for their fibro symptoms. This study out of PubMed showed that light therapy helps significantly improve all kinds of fibromyalgia symptoms compared to the placebo group. Definitely a great therapy for somebody who's suffering from this condition. We've talked about anti-aging a little bit, but it really is a great, wonderful thing that you can do at home with the light system. This study was published in a dermatology publication, and the people got light therapy 3 times a week for 12 weeks. And at the 12-week follow-up, 91% of the subjects reported better skin tone, and 82% reported enhanced smoothness in the treatment area. Light therapy reduces fine lines and wrinkles, helps build collagen, and helps increase elasticity in the skin. It's quite wonderful for anti-aging. We've talked about the skin a lot. Just a picture of my client before and after 6 weeks of light therapy. Had severe eczema, and he was exposed to a lot of chemicals that caused this, and it really helped him greatly. And let's not forget about our furry friends. The bottom line is light therapy is really great for people. It's really great for animals too. So many people use it on their animals for arthritic hips, you name it. And even if they don't have anything particularly wrong with them, or if they haven't told you, they just love the energy. So share it with your animals. It's pretty sweet to watch. The last segment that I'm going to get into is the brain and why we want to treat our brains with red light therapy. I talk a lot about brain health. Usually we're talking about neurodegenerative things like Alzheimer's and dementias and traumatic brain injuries, but let's just talk about the healthy brain. How can light therapy help someone who seems to feel like their brain's functioning great and they're not having any issues? Light therapy is going to increase blood flow in the brain and help with capillary growth and getting blood to areas of the brain that aren't getting it. You're going to get a lot more ATP and oxygen in the brain, and really cause an anti-inflammatory effect when you actually do the lights on the brain. There's a lot of experts that are weighing in on this. Dr. Michael Hamlin is the #1 expert on light therapy in the brain, and he has some really amazing articles and YouTube videos out there who can really explain what all it can do for you. But definitely something to think about for brain health. For example, here are 2 studies that are just looking at just brain function. In 2013, there was one study on light therapy looking at cognitive performance. It showed quicker reaction times, better memory, more positive moods, improved executive function. I don't know who couldn't use a little bit more of that. And there was another later study that looked at learning, the ability to learn and retain, and it was also very positive. So 2 great studies. Just why would you put light therapy on the brain? Here's 2 good studies to read. That Dr. Hamlin that I was just talking about out of Harvard authored an article called Shining Light on the Head, and it's been published in the National Institute of Health. Shining Light on the Head. Look it up. It's about 30 pages. It's really exciting about all the things that light therapy can help with, whether it's just brain health like we were just talking about, or traumatic like a brain injury, neurodegenerative, dementia, Alzheimer's, psychiatric. They're looking at depression, PTSD, and even neurodevelopmental like ADHD and autism. They're looking at all of this stuff, and that article is packed with incredible information. Wouldn't it be great to actually see a brain that had been doing light therapy? Well, I'm getting ready to show it to you. This study was a 6-week study performed on veterans who had PTSD and brain injuries. They're pretty bad off. And we partnered with a company called SareScan, which is a SPECT scan imaging company in Denver, Colorado. These gentlemen did 3 20-minute sessions a week for 6 weeks. So they did a scan, then they did their light therapy, and then they did a post scan. And this is what we found. The top 2 pictures are before the light therapy. Blue and green represent very low blood flow, and gray equals good blood flow. So this gentleman did not have much going on upstairs. And then after the 6 weeks of therapy, you'll see how it's significantly improved in the post-brain scan. Just a quick 6-week study. People who have injuries need a lot more healing. But I can only imagine what these brains look like after several months of light therapy. It has been my pleasure sharing all the things that I know about light therapy with you. I just hope and pray you will find light therapy to be life-changing for you. And if you'd like to have a conversation with me, here's all of my information. There's a million ways to get a hold of me. And I hope to help you. And I want you to know I really appreciate your time and I wish you the very best. Thank you.